and a great friend of CAHO. He's a big name in the industry, Dr. P Bhatia. He is the CMD, Astron Healthcare, the chairman and the advisory council member of the Venkateshwar Hospitals. Sir has been in the forefront of innovations, early adoptions, and he is a great proponent of technology adoption and innovation. So I hand over to Dr. Yashpal Bhatia for his remarks on how important is adopting to best practices for the industry. Over to you, sir.
Thank you so much, Lalu, for very, very kind words and I would say a very honorable introduction. And thank you, Dr. Vijay Agarwal, Harsh Mahajan, and all friends who are on board today for giving me an opportunity and giving a very humbling experience of calling me as a chief guest for this particular occasion. We are talking about technology and innovation, and we are in the era when the technology has been in the forefront for last, I would say, 2 to 3 decades. In fact, the healthcare industry has reached a level where technology is overtaking probably everything else that's happening. In fact, when you look at it in real sense, you look at any of the brochure, any of the website, any of the publicity material of any healthcare institutions, one thing which you find in common is state-of-the-art technology. That's the word which is always used. By the time I spell the word technology, by the time I spell the word innovation, the technology has probably changed 100 times in that much time itself. The main question which is coming up, I think, over a period of time, while we are looking at providing the technology, but we are actually talking of creating a technology at a cost. And a cost where, the 3 A's of healthcare, one of them which is affordability, that could also be addressed to. So my thought always goes into not the state-of-the-art technology, but the optimal technology for what's required. Not using a sword where we need a needle and not using a needle where we need a sword. So that's kind of thing. And the second is, the technology may be there, the adoption of technology. Now that's something which needs to be taken care of. The adoption of technology is something which probably becomes the most important. And as early we adopt, as much we can put into use for the patient safety and welfare. I think that's what is the whole concept which we are running around. And what do we have with us in the organization? How do we innovate? How do we put into practice? How we can able to use it horizontally across the organization and healthcare system? A main worry has been that, the healthcare somehow gets restricted to vertical towers of excellence. We have the best of institutions in the country. But does the healthcare have to be restricted to these vertical towers of excellence? It has to move horizontally. Then only it will impact where it needs to impact. That's the overall population. And unless that happens, the end result of the healthcare outcomes are never going to be achieved. And I think these are the innovative practices which are actually going to impact the adoption of technology to make it happen. I am sure that with today's participation, the way I'm looking at so many big institutions participating, including my alma mater, that's AFMC. I saw the AFMC also participating in that, Max Healthcare and Kaveri, and practically all big institutions are participating in this particular event. I'm sure the outcomes are going to be very, very interesting. More than that, what we need to do is not only they are interesting, they need to be adaptable to the horizontal system. The more we can adapt them and adopt them in the institutional system, I think it's going to be of great help. And CAHO is going to be playing a major role in dissemination of what we are discussing today. It's not only creating an innovative program. I think what's even more important, that innovation can actually be put into use by the people at large, and at the end of the day, benefit those for whom it has been meant for. Many times we are only proud of our own innovation, that we have done a great job. But how that great job has impacted the society, how the great job has impacted the profession as a whole, how the great job has actually reached people is the real fruit of the pudding that we are really talking about. With that, thank you so much everyone for giving me an opportunity to be with you. Thank you so much for creating this environment where we are talking of innovation as a lead and creating it something which that innovation is going to lead to overall the benefit to the healthcare profession, the patient community, and of course the healthcare profession as a whole. Thank you so much.
Thank you so much, yes sir, for those words of wisdom.